GLP-1 medications like semaglutide and tirzepatide are tremendously helpful for losing weight. GLP-1 drugs help regulate blood sugars and also help support weight loss. The medications are highly effective for diabetics. The way it works is when you eat, your blood sugar spikes. And for those that are diabetic or even pre-diabetic with insulin resistance, they have a hard time maintaining or regulating their glucose. A common question that I get asked is this going to cause hypoglycemia where your blood sugar tanks? Well, the answer is no, but it could. The medications are very safe, and there's really no risk factors for hypoglycemia unless you're malnourished or you're not eating or you're doing excessive exercise without the proper nutrients to support it. One of the biggest issues with diabetics is they can't control what's called postprandial hyperglycemia. Postprandial means after you eat, hyperglycemia means an elevated blood glucose. It can take many years for someone to develop diabetes. It's that prolonged insulin resistance where your body has to produce more insulin to combat those elevated glucose levels. Let me try to explain this a little bit easier. For those without diabetes, it takes one insulin to combat one glucose. And I'm making this very, very simple. So when you eat, your glucose goes up, your insulin responds, and then it brings that glucose down into a normal range. The normal range is about 80 to 130. For those with prediabetes or insulin resistance, it takes multiple insulins to combat that one glucose. If you have your glucose spiking, normal person will take one insulin, brings it down. Those with diabetes, it could take two insulins to combat the one glucose, and that's how I would bring it down. For those that are very poorly diabetic and require insulin, it might take 2, 3, 4, 5, 10 of the insulin to bring it down, and which is why they would need supplemental insulin. So now you might be asking, well, how does this help with weight loss? There's three main reasons that the GLP-1 drugs work really good for weight loss. The blood sugar regulation is the first one. So not only does it stimulate insulin and help regulate blood glucose, they also help inhibit the release of glucagon. And glucagon is a hormone that raises blood sugar levels. And for those that have high glucagon levels, typically have a really hard time losing weight and maintaining weight loss. The second reason is the medication slows gastric emptying. We call it delayed gastric emptying. What this means is when you eat, the food's going to go into your stomach and it's going to sit in there longer. Therefore, you shouldn't be able to overeat as easily. Now, with that being said, the whole GI tract does slow down. So this is where people can have nausea, constipation, diarrhea. Another thing to consider is that the medication can cause what's called cholestasis, and this is a result of the delayed gastric emptying. Cholestasis is where your gallbladder isn't pumping out the bile as efficiently or as much. So there are risk factors for developing gallstones. If you hear of people getting their gallbladder removed on treatment, this is probably why. The GLP-1 drugs also affect the brain hunger centers. One of the most fascinating responses from the medication and how it helps with weight loss is it helps control the signal from your brain to your stomach and when you should feel full or when your body's saying you need to eat. So it is kind of like a two-way street. So if you are on a therapeutic dose, you'll actually not really think about food much. We call that hunger silence. Hunger silence is one of the main goals in treatment, and typically this is where a lot of our patients struggle. For the majority of people, we can't turn off that switch that tells us we're full. So we constantly think about food. When you're constantly thinking about food, that increases anxiety. It causes a lot of stress. Food is not cheap anymore, so that would also build stress. And when you get to a therapeutic dose, there's such a sense of relief, and you really feel just this sense of freedom. It's really hard to explain unless you've been on treatment. And for those that are on treatment and understand this, they know exactly what I'm saying. At Zip, we like to use the slogan, "It feels good to feel better." And I think this really stems from this hunger silence. It should also be said that when you eat, the medication does stimulate ghrelin, which makes you feel full. That is that satiety or fullness sensation. So you might feel full without even eating. Or when you get hungry and you go to eat, you should feel full relatively quick. And that would be if your dose is effective. For me as a provider, I think one of the most frustrating things that I see in common practices with a lot of the online companies or other providers prescribing these meds is they're titrating medications up way too quick. When we prescribe medications, we really need to understand how they work. What's the half-life? How long does it take to get a therapeutic dose? And I'm here to answer that for you. The half-life, which means how long does it take for that peak effect of the medication to start dwindling down? That half-life is 7 days. So after your first dose, it might start to wear off on day 5 or 6, and then you start to feel hungry again. But we have to remember it takes 30 days for a dose to be therapeutic. So increasing our dose before that 4-week mark really isn't that wise to do. I think it's also important to remember that weight loss is not a quick fix. It takes time to lose weight. If you were to go do a diet and reduce your calorie intake just the same as you would on the medication, it's going to take several months, maybe half a year, maybe a full year to really lose a significant amount of weight or hit your weight loss goals. I think it's very important that we treat this medication just like any other medication. Antidepressants, high blood pressure meds, thyroid meds. The goal in treatment is to keep you on the lowest effective dose possible. If you have high blood pressure and you're doing really well on a low dose blood pressure medicine, your blood pressure is stable, you feel well, there's no point in raising that dose. The same thing would go with antidepressants. If you're doing really well on a low dose, we're not going to increase it. We're going to keep you there. If the dose becomes less effective over time, that's when we would increase it. With that being said, I hope you were able to learn something today and really dive deep into how these medications work. This video is just for educational purposes only. If you want to book a consult, I'm happy to go over all the medications we offer. I just want to keep people informed and help them understand how these medications work. As a provider, it's very frustrating to see other companies kind of do this treat and street type of mentality where people are filling out forms, they're sending them meds, they're not providing them the proper education or the follow-up. At Zip, we ensure all of our patients are in close contact with the provider. We want our patients to feel heard, listened to, and know that we are here for them. So if that means being your cheerleader and hyping you up to help you lose weight or keep you on track, that's what we'll do. I know for me, it's very hard to maintain a diet unless somebody's really encouraging you or, giving you positive feedback. So if you're trying to lose weight and you really need a good support system, I am absolutely here for you and I would love to help you. If you have any questions, feel free to reach out. Our business number is on our website. You can text it. And we're looking forward to talking to you and helping you out. So we hope you feel better. And is it.